We have a crisis on top of a pandemic, and there's a call to action to do something about it.
Overdoses among children has risen dramatically in the past 2 decades. New research from OHSU shows the largest jump is among kids 10 to 12, with a 4.5-fold increase. That's nearly double the increase among older adolescents. These attempts for self-harm or suicide come from medications commonly found at home. This is a tough subject, but one local doctors say cannot be ignored. I went to Dr. Kyle Johnson with OHSU's Division of Child and Adolescent Psychiatry and Senior Medical Director of Regents, Dr. Mike Franz.
Usually when we think about teenage suicide, we think about teenage suicide. Here we're not even talking about teenagers. We are talking about generally prepubescent children, ages 10 to 12, and this is a terrifying statistic, and one I think that brings a lot of sobriety to the way we should be thinking about what's going on in our society, what we can do to prevent this.
Dr. Johnson sees teens and kids who come into the emergency room and pediatric care. His team at OHSU is behind this recent data.
Found that the vast majority of medicines used by youth to attempt suicide are those readily available in the home, either the youth's own medicines or a family member's.
Medications found in the home, whether it be over-the-counter or prescription, were involved in nearly half the cases.
A large proportion of youth who decide to attempt suicide make that decision within 5 minutes to an hour before they actually attempt. So again, it's very impulsive. Something stressful may happen. They feel hopeless.
That's why blocking access to the means is crucial, and he says it can save lives. Dr. Johnson and Dr. Franz say that means securing your medications at home, and the best way to do that is with a medication lockbox.
Basically, it's a lethal means restriction approach where we really need parents to secure medications in the home, especially if there's any increased risk for this use of this intentionally.
And they say we must look at the bigger picture, addressing mental health in our kids, and that starts with awareness and listening.
I think we first need to start directly with our children, and as parents, we need to just be listening, be available, be present, and be open. Pay attention, see what's going on with your kids, give them space to talk.
And then not being afraid to ask. We know from research that asking does not increase the risk of a teenager or an adult of attempting or dying by suicide. It actually can save lives. So don't be afraid to ask. If you observe a youth really struggling.
If you or someone you know is struggling, help is available 24/7. Just dial that number on your screen, 988. That's the National Suicide Prevention Line, connecting you to local services. And in next week's Healthier Together, we'll take a closer look at this new number as a resource for help and hope. We'll talk to Lines for Life about 988 and how it aims to save lives.